Hello everybody, and welcome back to the H-Invest channel in 2026. So, I've had a few comments recently asking me where I'm currently at with HIMS stock and what I think the prospects are of the business going forward. I put out some slightly more bearish commentary in the summer after a slightly shaky Q2 from HIMS, have subsequently made a couple of videos, but I'm here to say now that I believe that this company is going to a new dimension in 2026. I'm very excited to be a shareholder, and I'm very excited that HIMS is my largest holding. Please remember that having a company like HIMS in your portfolio, yes, it carries a lot of risk because HIMS are taking on the Goliath, which is the legacy healthcare system, and that also carries a lot of volatility, which is separate for risk, right? The company may be going stellar, but I've seen that whilst the company's been going very stellar for most of its time as a public stock, I've seen many doubles and halves in that share price. So just know that if you are a HIMS shareholder, there's obviously that to contend with. What I wanted to do in this video, because it's a fresh year, it's all very exciting looking at all the new things that HIMS are doing, and we will talk about that, and we will talk about why I think some of the new things that they're doing and planning to do are going to completely change the game for this company and help it to compound even further in its journey in completely reinventing the healthcare system. But what I also wanted to do is just bring it back to basics for a minute. I had my original video on HIMS, which I made just over a year ago, and it talks about those core pillars of disruption, regardless of health category, GLP-1s, blood testing, peptides, whatever it happens to be. And I think it's very important to remember those tenets and core philosophies that Dudum has baked into the company. Now, what this is fundamentally is it's a business that is revolutionizing healthcare, because the way that healthcare works in the United States is that there are so many middlemen within this system, right? You've got insurance companies, which a lot of people are obligated to pay for health insurance through either the law in that state or they pay for it automatically through their work. And even when people pay those, a lot of the time the deductible is high. Some people have deductibles of over $2,000 a year, right? So even though the insurance company is covering you, if you're a young, healthy person and you just maybe want to get some hair loss treatment that might cost you $500 a year, right? The average treatment on HIMS is about $50 a month. So we call that $500, $600 a year. The health insurance company won't even start covering you until you're over that $2,000 a year. Also, there are pharmacy benefit managers, which are actually owned by the health insurance companies, because if the health insurance companies didn't buy them, the incentives would be misaligned, right? For the health insurance company. So you've got all of these people taking a huge cut. Pharmacy benefit managers basically hold auctions. These are auctions where drug manufacturers have to bid and pharmacy benefit managers negotiate cuts in order to get drugs higher and higher up that formulary list, so that when you're sat in front of a doctor's office and you show them your insurance, oh, these are the drugs with the lowest copays. But it's also ironic because, you know, those drugs, even though they're cheaper for you, there's still been a huge hike in terms of prices because manufacturers have had to pay ridiculous rebates to the pharmacy benefit managers to actually get them to the top of the formulary. If all that sounded extremely complicated, that is because it is. And HIMS is one of those companies that completely goes direct to consumer, cuts out all the middlemen and says, forget insurance. It's too complicated, it's too slow, and it's too bureaucratic for us. It's not aligning incentives of the healthcare industry and patients, even when doctors and patients may be aligned. And this is evident because HIMS has a long-term gross margin target in the mid-70s. Isn't that crazy? You look at how they can sell direct-to-consumer generic drugs for a fraction of the cost of the legacy industry, even though sometimes you're using insurance, right? Doesn't that show you that they can retain these high gross margins, yet at a fraction of the cost? Doesn't that show you all of the costs that are bloated? Not only do you have this whole industry with insurance companies and pharmacy benefit managers that HIMS are disrupting, but remember as well, there are so many other costs associated with the legacy healthcare industry, which for the majority of treatments in the 21st century are really just unnecessary, right? As I said last year, imagine the conventional process. You've got to find a doctor, match that up with your insurance company, drive to a doctor's office, wait in a room. The doctors are unfortunately often under a lot of stress. Then you've got to speak to the doctor. He's got to write a prescription, and he's got to be able to write it so that the insurance company will actually accept and at least cover some of the costs of this drug for you. And then once that's done, you've got to find a pharmacy, and then you've got to go to the pharmacy, hope that the pharmacy has the drug that you need in stock, and then come home, and then that will be the process done. Now, it's also obviously more difficult to get doctor's appointments at weekends. Some pharmacies aren't open on weekends. So it's not just the cost of that. And remember, the cost is going to be baked into the price somehow, whether that's the doctors that charge the insurance companies and then the insurance companies inflate their prices, or if that's reflected on the price of the drug. You are the end customer, and you still pay for that inefficiency, when for many medications it would make much more sense just to fill out an online form and say, dum dum dum, I have this problem. No physical examination necessary, just a doctor approving a prescription. You're also paying with your time. So you're not only paying your extra money, you're also paying with your time. As I said, somebody may have to take 2 separate mornings off work to even go through that whole process, right? You don't want to miss a doctor's appointment. And all of this means that HIMS can simultaneously offer a customer experience. Dudum and his board and his team are relentlessly focused on that customer experience. They can offer a customer experience that's an order of magnitude better and simpler, but also for way cheaper, and retaining those high gross margins, which allow that free cash flow to fall to the bottom line and for them to reinvest in the next amazing vertical in their business. And further to the inflationary nature of the health insurance industry in America is that even though it may seem like you have a lot of choice when you're taking out health insurance, most of those brands have been bought out by just a few large players that dominate the majority of the market share. Obviously, you've got United Health as the largest, and Everlance and Cigna, 2 of the other largest as well. And typically by state, you only have a small number of insurers to choose from. So what we've got is a very small oligopoly where insurance companies can get away with hiking premiums further, and people have not got a significant amount of choice to switch between providers. But coming back to the issue more broadly, because what we're talking about here is we're talking about treating conditions and keeping people healthy. What we unfortunately have in the United States, which is obviously the prime country that HIMS operates in, is a healthcare industry that's not really incentivized to keep you operating at your maximum, because it's a for-profit industry, right? The more you're sick, the more treatments they can sell you, the more surgeries you can have, and thus we have this perpetuating cycle of people being constantly sick. So there's actually no incentive alignment with ultimately what the customer wants, which is to stay healthy. And the beautiful thing is, HIMS is actually moving away from that. Yes, they have a subscription-based model for medications, but because they are so lean and so nimble, and there's no autocracy in the sense that there's no bloated legacy insurance system dictating what they can sell, what they can't sell, what rebates they need to pay, they can effortlessly customize medication and have a direct relationship with that customer. Listen to their needs. The customer can provide them feedback, and HIMS can alter the treatment. If they're not happy, then they can cancel their subscription on HIMS. And I also firmly believe that Dudum fundamentally understands that he is built an award-winning consumer brand, and of course has spent a lot of money on sales and marketing. Now, your brand can be your greatest asset, but your greatest asset can also be your greatest liability, right? So with a strong brand, you have a strong association, be it positive or negative. So HIMS has a really strong incentive to not erode that trust and to keep that trust positive by relentlessly optimizing the customer experience, which is at the very top of his value priority list. It's extremely exciting that HIMS are now expanding internationally, and whilst most of the other countries are expanding into Canada, France, Germany, Ireland, and the United Kingdom do have national healthcare services, a lot of them are extremely fragmented. For example, in the United Kingdom, the country which I live in, of which I have personal experience with the healthcare industry, it's frustrating because people spend a lot of their proportions of their taxes on this system. And the healthcare system, whilst we're grateful to have it, was founded in 1947 when, number one, we had a very young demographic. It was a baby boom, so most of the population was quite young, and when the population did get sick, they would typically pass away much sooner. And the NHS got very good at treating sick care, but the problem is that because we have such a high proportion of people now that are older, it's coming under more and more strain all the time, and is currently just not designed for the absolute demand that it has. And of course now the country is in much more debt, so we're basically struggling to keep that afloat on top of all of the interest payments and the other expenses that we have to pay. Now, this is also amazing because there will be significant demand for HIMSS services, and even though we have that free at the point of use, all of the other factors apply, where you still have to go to a doctor's office and sit down with a doctor, and all those costs, the massive cost of that hospital building, which might be 5 million, 10 million, all the costs of running that, all of the administrative staff, which the hospitals are not going to automate, but HIMSS is largely automating and just has human oversight. All of those costs are going to be bloated into that system, but not just in terms of money for the taxpayer, also in terms of your time. Right? It's still going to be extremely time costly. And unfortunately, what's happened in the NHS and many other countries, particularly in Europe where HIMSS is expanding into, and they've got increasingly aging populations, people that are very reliant on this system and are net consumers of it, rather than net producers in terms of their using the NHS more than paying in tax revenue, even though they've been taxpayers in the past. As the NHS gets under more and more strain, their priorities switch to, let's save this person's life right now. But what's happening now is, as the NHS gets more and more under strain, it's very difficult for them to take care of everybody at all times, and thus they're prioritizing the most immediate of circumstances, which they should. But at the same time, it would be more optimal if they focused on prevention as well as just sick care, right? So they may be better at treating someone in an emergency, life-threatening situation, but when you come under massive budget pressure and strain, it's much more difficult, for example, to see the quantitative ROI of very early detection in some illnesses, right? Looking at preventative healthcare. But that's where the highest ROI is. But because they're constantly under strain, they're not so much looking at that kind of thing. Imagine if the NHS sent out blood tests all the time and built an AI database where they're constantly scanning and analysing people's blood tests to eventually see any early detection. For example, I actually had some really bad headaches a few years back, and it was really unusual, very specific headaches. I got a little bit worried about myself after these headaches got worse after a couple of months, but the NHS would not give me an MRI. And it's frustrating because, let's say, for example, I couldn't afford to get a private MRI, or I didn't decide that a private MRI was worth it to scan my brain and make sure I'm okay. Let's say I had a really nasty illness in my brain, right, that would have cost hundreds of thousands of pounds to fix, potentially my life. So there's hundreds of thousands of pounds, if not millions of pounds of tax that I would have otherwise paid down the line. And also, what price can you put on a human life, right? Whereas actually doing the MRI just would have cost a couple of £100. And unfortunately, those are the kind of optics that a lot of the healthcare industries across a lot of the developed world are in, as the population continues to age, and it will be even worse in 10, 20 years time because the birth rates are continuing to decline, so you just have less of a working population to prop up the tax that they're going to need in that healthcare system. So what I'm saying is a lot of people will have to take preventative healthcare into their own hands. It is just going to be a fact. And that's where HIMSS have huge potential in the context of their international expansion. Now, obviously, the final thing to note is their blood biomarker testing really changes the game for two reasons. Number one, as I said, it switches that model even more to preventative care. So HIMSS is aligned with what the end customer wants. The end customer wants to be healthy. They don't want to feel sick. And even if you do have a condition, boy, does HIMSS make you feel much more better about it than the legacy healthcare system. But also, the quality of your data rapidly improves. It's individualistic. And this is what HIMSS is building as well. Instead of just giving you some one-size-fits-all medication, HIMSS can now customize the dosage. They have that data on you. For example, before, they had your height, your weight, and how much you exercised, how much you drank. They had this sort of data. But now they're going to obtain much more granular data through blood and biomarker testing to determine which medications are optimal for you and what kind of patterns they can recognize in order to generate insights in healthcare even further. And this is another beautiful thing about this, is that, as with all things, HIMSS are doing it as a fraction of the cost. and still making profit from it. How are they doing that exactly? Well, firstly, it's the same game with the legacy healthcare system, right? So because they're so streamlined and they control that whole process, they don't have all of those bloated costs. If you went to a legacy provider, they might charge £300 for a 20-minute face-to-face consultation, which reflects both the doctor's wages, the admin's wages, and also the cost of the building and that facility. HIMSS doesn't have all of that bloating in it. At the same time, the value of the blood test is not just a profit from the blood test, but it's the data that HIMSS obtain, which can help them to help people further in terms of keeping healthy and obtain a more comprehensive picture of people's health overall. And I think also having one quantitative number where people can actually obtain their biological age and see how that moves over time is really going to motivate people, particularly if that number becomes higher than their chronological age, and will actually help them to make improvements and get healthier and incentivize them much more to be healthy rather than the legacy healthcare space, as I said, because of its build in the United States. And because it's under so much pressure in many of the other countries that HIMSS are expanding to, will just not be able to offer the same level of either personalization or preventative care. So this is the massive opportunity for HIMSS because it's a ridiculous market, and what value can you put on keeping people healthy and keeping people alive? And a lot of these businesses are all going to come together for HIMSS in 2026. That's why I'm exceptionally excited about this company going forward.